Welcome everyone, my name is James. Today I'm going to walk you through a cricothyroidotomy using the Bougie aided open surgical technique. Remember, when performing a surgical airway, there are 3 approved methods by the committee of TC3. Whichever method you prefer, it is important that you remain proficient and you practice prior to performing this procedure on an actual casualty. Once the surgical cric is indicated, you will start by preparing your equipment. Inflate the bulb with 10 cc's of air, looking for any leaks. Ensure you have your scalpel close by. And prepare your bougie. And then you'll use the head tilt chin lift method to visualize the larynx. From there, with your non-dominant hand, you'll place the larynx in between your thumb and first finger and then palpate for the cricothyroid membrane. Once you have your site selected, you'll prep with either an alcohol wipe or iodine. And again, stabilizing, this can move quite a bit. So you need to apply a little bit of pressure and make sure that the head is nice and extended. From here, we'll make a vertical incision from the top of the cricothyroid membrane to the bottom. And so, as you apply enough pressure, that skin will naturally fillet open, and then you'll be able to see the cricothyroid membrane. With that, you'll make a horizontal cut, and you will place your trach hook. And I'm using anterior pressure to visualize the trachea. You'll insert your bougie into the trachea, and you'll receive tactile feedback to ensure placement, and you'll be able to feel the tracheal rings as you advance your bougie into the airway. Once the bougie is inserted, you'll remove your trach hook, and then slide the tube down the bougie into the airway. Once your tube is all the way inserted, you go ahead and remove your bougie and inflate your bulb with 10 cc's of air. So once your tube is in place and you've inflated the cuff, suction to ensure that the lumen is clear. You look at the tube, you confirm if you have misting on the tube or bilateral rise and fall of the chest if the patient is unresponsive. If you have someone to help you, you'll secure a BVM and use a stethoscope. You'll listen to the epigastric region as well as visualize bilateral rise and fall of the chest and listen to both lung fields. Once you've confirmed a compliant airway, you'll go ahead and secure the tube to the patient. And once you've secured your cric, you will reassess your intervention, monitor SpO2, and document all casualty care on a DD Form 1380.